elderly face NHS discrimination under the new UN death targets. Now, I know if you're like me, you're wondering, what is NHS? So I did a little research, and it's actually England's version of Obamacare. They had it first. Actually, theirs was what ours was modeled after. So even though this is England, it's not us, I feel like this can be used as an example of what ours should be, if at least to the people that created our wonderful new medical system and insurance. Anyway, basically what this is about is that if you're over 70 years old, according to the UN, you are no longer productive in society, and even though you may pass on from, let's say, breast cancer, you won't get the breast cancer surgery that you need to live. So when you die, you're actually not listed as dying from the disease, but just from old age. And it goes on to here that according to a lot, I mean, you can read it here. I mean, there's a lot of people over there that have to do with this that are against it. They said that if the target was met, around 42,000 lives would be saved each year for the under 70s. But if they included the older people in their treatments and them able to get their drugs and their surgeries and the hip replacements and the knee replacements, 130,000 lives would be saved. Kind of a big difference. I just feel like that they're the example, and that's what they want us to be here. Just something we need to keep an eye on so that it doesn't happen. I'll leave the link to the website, as well as to where it actually a site that says what NHS actually is, so you can go there and look for yourself. Anyway, thank you for watching my video, and God bless.